The WHO is urging wealthy countries to stop vaccinating children and instead are asking them to donate the doses to poorer nations. And this comes as the UN health body warned that the pandemic's second year would be more deadly. Now, Dr. Tedros has called on countries to give their doses to the COVAX scheme, the global vaccine sharing initiative that distributes vaccines to poorer nations. Instead of offering jabs to youth and healthy people, Tedros says that donating the vaccines will mean that those most in need in all countries will have received the protection.
I understand why some countries want to vaccinate their children and adolescents, but right now I urge them to reconsider and to instead donate vaccines to COVAX.
Nearly 1.4 billion doses of the COVID-19 vaccines have been administered around the world. Around 44% of the doses have been administered in high-income countries, countries that account for only 16% of the world population. Just 0.3% have been administered in the 29 lowest-income countries, home to over 9% of the world's population. This inequity in access to vaccines means that the second year of the pandemic could see more deaths than the first year.
COVID-19 has already cost more than 3.3 million lives, and we're on track for the second year of this pandemic to be far more deadly than the first. Saving lives and livelihoods with a combination of public health measures and vaccination, not one or the other, is the only way out of the pandemic.
Now, a new British study has found that the Pfizer vaccine is more effective among older people if the second dose is delayed to 12 weeks after the first. The study is the first to directly compare immune responses of the Pfizer shot from the 3-week dosing interval tested in clinical trials and the extended 12-week interval recommended by British officials. Pfizer and its partner BioNTech have maintained that there was no data to back the extending of the interval after Britain moved to do so. The study, which has not been yet peer-reviewed, looked at 175 people aged above 80 and found that extending the second dose interval to 12 weeks increased the peak antibody response by 3.5 times when compared to those who had the second dose after 3 weeks. Now, this study comes in the heels of India also deciding to extend the interval of doses of Covishield to 12 to 16 weeks when before it was 6 to 8 weeks. White House medical advisor Dr. Anthony Fauci has said that India's decision to extend the gap between the two doses was a reasonable approach and that the gap was not long enough to have a negative effect on the efficacy of the vaccine. WION is now available in your country. Download the app now. Get all the news on the move.